Hello, it's Dr. Soda speaking, and here we are, another good self talk. And today we're talking about men's health awareness, and we're really going to focus that in to mental health because you may not know this, but November is Men's Health Awareness Month, and I think that's worldwide, but certainly in the UK it is the case. And as I saw earlier in the year around men's mental health awareness, we're not seeing a conversation about men's health. It doesn't seem to be coming into the narrative, even at a public health level, but neither also in social media or even men who this is all about them. They're not even talking about it as well. I think there might be a certain number of reasons about that. But today we're going to talk about mental health and men. And the reason I'm talking about mental health as a diabetes practitioner is because although I'm a GP, I focus my most of my work in diabetes. But the reason I'm talking about men's mental health as well as metabolic health is because they're so closely interlinked. There's so much that happens or that can be done for mental health that can help metabolic health and vice versa. And we know that there's a close interlink between depression and anxiety and diabetes. So when we see one of those rates go up, then we start to see the other go up, and vice versa. When we see diabetes go up, we start to see depression and anxiety go up. So let's just look at some key facts around mental health in men and women. So interestingly, women are twice as likely to be diagnosed with anxiety than men, and also twice as likely to be diagnosed with major depression compared to men. But men are nearly three times as likely as women to become dependent on alcohol. They're also more likely to be admitted to hospital for drug related mental and behavioral disorders. And men are much, much more likely to take their own life, with 80% of suicides. Now, there's a varying number there depending on what stats you look at, but roughly 80% of suicides are men in the UK, and across the world, that rate seems to be fairly similar. But certainly, the key message here is that suicides affect men much more so than women. So why do I think that's the case? Or why do we think that could be the case? Why is it that we're getting higher rates in women for anxiety and depression, but we're getting higher rates of the severe consequences of conditions like anxiety and depression, including things like suicide? Well, I think it comes down to three, perhaps four things that are leading to this. The first is a stigma around talking around mental health conditions. Men, when they open up, they often feel a stigma, but also other people may not also be receptive to men experiencing mental health conditions. So that leads to men perhaps feeling that they can't open up and closing down. I'm not convinced that there's a genetic reason for this. I do think it's mostly societal and cultural, but certainly there are differences in terms of men's position in society historically and women's position historically. And then that might actually have an impact on how men communicate around their mental health. But we're not going to go into that in more detail today. I think that's a whole subject in itself. The second thing is this messaging. Men and women, we hear that public health message around lifestyle medicine pillars. That's eating healthier, moving more, reducing our stress, having a better sleep, avoiding things like smoking and alcohol. And another one which less people know about, but it's fairly commonly known, is around relationships and having good social connections and social relationships. All these are really, really important. And most people know that. But connecting that to illness, disease, and severe episodes, such as and including suicide, that's where we have a disconnect. And I think that there is a disconnect more so in men in connecting the actions that they're taking on a day to day basis and what happens at the end, or what happens when things get really serious. And certainly, there's no point treating a severe illness with trying to eat healthier at that stage, but the sequelae and the consequences of not eating healthy over periods of time, combined with exercise, combined with isolation, combined with other stressful factors across their lives, then can contribute to together to worsening mental health symptoms and then contribute to the development of and perpetuation of disease states like anxiety or depression. Excuse the mental speak, I apologize for that. The third thing, seeking help early. I think this probably comes into the stigma around this, and that we find that when when women tend to experience an illness or a condition, they tend to come to the doctors earlier. Now, I don't have the data on that in front of me, but anecdotally, I can tell you that women will seek help earlier as a stereotype, as a population, and that doesn't account for everyone. But generally speaking, I'll see that women will tend to seek help earlier than men in terms of seeking help for their illnesses. When you seek help earlier, the difference between being healthy and being sick is the gap is smaller. So to get back to being healthy takes less time and can be um, dealt with in a more adequate, earlier manner, which means that you can probably get a better health outcome. Now, I think this is why we see that difference in rates between women being diagnosed and men being diagnosed. We've got to be careful with the data. The data isn't directly saying that women experience depression and anxiety at twice the rate of men, which some people can take from that. This data is saying that women are being diagnosed at twice the rate of men. And for someone to be diagnosed with a condition, they do need to seek help. And when men seek help much later, they may be being diagnosed, but some people aren't being diagnosed. And I think that there are a number of people that aren't being diagnosed that then are going on to have severe impacts at the end with their health. And that includes attempting to take their life, suicide, and also being admitted to hospital for the consequences of having poor mental health for a long period of time. If men were able to speak about their health sooner or presented to the doctors sooner or other health professionals, including psychologists, counselors, and even coaches for that matter, then we may not be seeing so much of the end consequences, severe consequences of poor mental health. Thing about mental health and metabolic health is that they both take time to change. These aren't things that just get better immediately. These are things that take time. You get a few days of going forward, a couple of steps of going back, and then a few steps going forward. And then sometimes you might have 2 weeks going back, and it feels like this is all falling apart. But things take time. And so these are conditions that we often think of as long term conditions. We used to call them chronic conditions. Chronic conditions, that's metabolic and mental health conditions, meaning that we can't get rid of them, we can't stop them. But now, with new data, new understanding, and going back to the basics and the foundational principles of what causes diseases, we're starting to see that some of these conditions are fully reversible, and at least we're able to put them into remission. So, on that, we need to make sure that people are connecting what's going on with their lifestyles and connecting that with their illness. And because it is taking time, because we can see that we can reverse it, these are now called long term conditions, or I prefer to use the term long term conditions rather than chronic health conditions or chronic diseases. Now, I want to just tell you a personal story about myself. And this is not a story to tell you, this is what happened to me, this is what worked for me, so this is what you should do. This is absolutely not that. But what I want to do is, I want to paint a picture of as diseases present and then it takes time to fix them, we can often think of the time that they develop is the time that we need to fix them. Now, that is not science there. I'm not saying that the exact time that a condition takes to develop is the exact time that you need to fix it. But what I'm saying is things that require a long time to fix have usually been taking a long time to develop. We often think of developing conditions like I was fine last month and now I've got anxiety or depression, or you see that in someone else. You said, "Oh, they were fine last month and now they've been diagnosed." Diagnosed this concrete split between being healthy and not healthy. And same with diabetes. I was fine and then I had my blood test and now I'm diabetic suddenly. It doesn't work like that. Things have been going on for a period of time. It's sort of as if the frog in the boiling water and we're in that position and over we don't realize the water's too hot until suddenly it's too hot and we're past the edge. The other thing about that is the straw that breaks the camel's back. The straw might seem inconsequential, or it may seem, well, how did that lead to this condition? The final stressful episode, the weight gain that you had just in the last 2 months of, say, 3 or 4 kilos. How is that then leading to these conditions? It's not. It's that on the back of everything else. It's the stress and the stress and the stress, and eventually it breaks. That was a side point. Let's just go back to this. So, like I said, this is not about what you should do, but it's just to recognize that time frame. So back in 2017, had been a GP for 2 years, and I had an opportunity to build a startup in healthcare online, and it would be an online prescribing platform. And I thought this would be quite a fairly straightforward exercise, but my skill set was in general practice and being a doctor and not in being business. So while I was setting this up and trying to get it built, I also joined an MBA program at Warwick University in the Midlands in the UK. And I also joined the NHS Clinical Entrepreneur Program, which is around helping doctors to develop entrepreneurial skills to be able to develop programs or develop their companies or ideas into something that can really help people and scale them up. I was also in a relationship, but I decided to move closer to Warwick, outside of London, where I could afford to buy a property, and I'd bought a property not far from the university, and the headquarters for that business was based in the Midlands. Now, as you can see, that's a busy, busy life to be a GP, to run a startup, to do an MBA, to be part of these other programs where I was learning, and also to have a relationship and buy a new property. Practically too much. But over time, this became my life, and it was working 7 days a week. And I used to be up pushing things, making things happen, and still trying to make my personal life work as well. Things started to happen, things that were very stressful with startups. Many of you may have tried building startups, you may have seen how stressful they can be. And things were starting to wear me down and burn me out. And I remember I was in the GP surgery, and I decided that I was going to see the GP because I knew that I was experiencing symptoms of depression. And now burnout is not very well known or understood or accepted clearly in the medical community. But a few years ago, I can't remember the exact year off the top of my head, but the WHO decided to recognize burnout. I think it was 2019, but I'll check the facts after this. The World Health Organization recognized burnout as a phenomenon, but they limited it to occupational workplace overwork and stress. So they didn't say that burnout could be a cause of personal related issues, but I do believe that burnout is much more than occupational stress. Whether it's occupational stress or personal stress, and it's consistent and relenting and doesn't slow itself down, and you're pushing yourself through it, and you know that you're pushing yourself through it, well, then eventually there's got to be a point where you can't do any further. We feel that, we really feel that within ourselves, don't we? We know when we're pushing ourselves, and we're knowing that actually we would normally stop, but because of other external factors or other things within us that's saying we must continue to push this because of whatever that target is, then we're starting to burn out. And usually you'll find that you need to recuperate after that. It might be a couple of days later, you just have to take a few hours off. You might find that on the weekend you're sleeping in longer, or you just can't do anything more on a weekend. You just need to sit and stare at the TV screen and watch a film and just like just let your mind completely slow down and zone out. Well, that's your protection. That's your way of getting back from burnout and saying, yes, I am going to recover and I'm going to get back to a healthy state. Now, when we think about that, we've got to think about the autonomic nervous system. That's the parasympathetic and sympathetic nervous system. Although we think of these as extremes, so at the extreme end of the sympathetic system is the fight or flight response, and at the extreme end of the parasympathetic system is your rest and digest response. But every day during the day, we're somewhere on a spectrum. We're not black or white on it. We are in there somewhere. But I would say it's very limited that we'll be right in the equilibrium, right in the middle. We'll be on one side of it. So right now I'm talking to you, I'm not stressed out, but I'm using my brain and I'm using my intellect to try and convey information to you. And as a result of that, I need more brain energy. So my blood flow is going to my brain, but the body doesn't discriminate so much between where the blood flow goes in the sympathetic zone. Now, I am in the sympathetic zone, but I'm not in the extreme end. I'm not in that fight or flight response. I'm not getting a big surge of adrenaline, but I do have a lot of what we call noradrenaline. And noradrenaline is that mild adrenaline that keeps us going, keeps us alert. So if I'm in the sympathetic zone, my blood flow is going to my brain, but it's also going to my muscles. It's going to places that gets me ready for action, whether it's using the mind or using the body. So if it's going there, The question has to be, where's it not going? Well, it's not going to my organs and it's not going to my digestive system, which is one of your organs as well. So if it's not going there, then what's it not doing? Well, it's not digesting. It's not repairing tissues as much. It's not a detox. The liver's not detoxifying as hard, and the kidneys are not getting rid of waste as much. And also the immune system isn't repairing itself. When you move into the parasympathetic zone, even just slightly, you're shutting down the brain blood flow, you're shutting down the blood flow to the muscles. Now you're taking blood flow to where we really want it, to recover, to help with your liver, to help with your kidneys, to help with your digestion, your digestive system, even your immune system and your skin. Have you ever noticed that after a few days of not sleeping very well, your skin feels different? It's because your body's not being able to continuously regenerate. And it all comes down to the sympathetic and parasympathetic system. Okay, so that was another um, side point on this story. So, yes, I was getting worse. I went into the GPs. And I remember this GP was very junior. He was training to be a GP. And I sort of had very good insights. I'd experienced a mental health episode of depression back in university. And I just looked at him and he was sort of at a loss, kind of really, of like, what does he explain to me? And I just looked at him and I went, either I stop the startup or you give me the drugs. And today I'm going to take the drugs because stopping the startup right now is not an option. And I knew that wasn't good for my health. I knew that the drugs, i.e., antidepressants, for me anyway, now everyone's different, and I'm just talking about my story. I knew that the antidepressants for me would not treat the root cause. I knew that they would help though. So I took them and I was worried about side effects because I'd experienced them before, not severely, but I knew that these medicines come with side effects. Of course, I prescribed them in the past and continue to prescribe them too. So I was taking them, symptoms got a little bit better. I was running this online startup. I became known as Mr. Viagra by my friends because I was selling and shipping lots of Viagra on the internet across the UK. And I was burning out. I was still burning out. Part of that was to do with values and purpose. I was running a company that didn't align with my values. It didn't give me satisfaction. And I didn't feel I was really helping, although I was helping people, but I didn't really feel I was helping in a way that I wanted to help people. I didn't feel that I could have done all my medical training just to be doing this. And when I say just to be doing this, for me, it didn't feel right. Now, for someone else, that might be their calling and their purpose, but for me, it wasn't. And deep inside, I knew that it wasn't. And I think that knowledge that I was running against the grain of what my body and my brain wanted to do was also contributing to that burnout. So now I want to mention to you a little bit about how does one get out of that hole? Well, the hole gets worse. So I continued on this journey with the antidepressants. I had sexual dysfunction, erectile dysfunction with it. I was putting on weight. I had mood swings with it. And then I would either feel like I had too much of the medicine, so I would just burn myself, and then I would really crash afterwards. Um, and I just didn't feel happy, but I didn't feel sad at points. Like it was this compression of my mood and my mental health really squeezed down. And it didn't feel right and it didn't feel normal. And I ballooned and my weight, I stopped going to the gym. So I lost a lot of muscle mass, but my weight continued to go up. And I went up by about 5 or 6 kilos, maybe 7 or 8 kilos. But it was just going around my tummy. I really have those genetics where fat doesn't like my arms or my legs. It just likes to hang around my tummy. My blood glucose levels were going up. So lots of things were happening. And it came to a head in Scotland on the 12th of June, 2019. And I was on Glencoe on a mountain in Scotland, a famous mountain for many people know it. And that was it. I just knew the mind switched and I knew that it was time to end it. And it was as if I knew that my body had had enough, that I just needed to go on a healing journey. So just like that, I made the call. And because I was the only executive director in the company, I made the call to non-exec directors and I said, it's over. I'm not doing this anymore. It was just like that on the mountain. And I cut the holiday short, came back home, cancelled the the CQC, the Care Quality Commission regulators visit that was happening the week after, which was for me the straw that broke the camel's back, having to do that while I was on holiday. And I closed the company. I seized orders straight away, and then I went on a healing journey. But this is the thing, that wasn't the fix. That didn't fix me. By that point, I was too far gone. So I continued on medicine for a while. I moved back to London. I actually ended up ending the relationship. I saw a psychiatrist. I got support from the NHS, who support doctors with something called the Practitioner Healthcare Programme, which is supported and funded by the government through NHS England. And I did get some psychotherapy, but unfortunately, they couldn't continue them, even though I needed them. And I continued on medicines for a while, but then after 6 months of psychotherapy and actually taking time out from work, and starting to pay a lot of the debt that I'd accumulated trying to run the startup. So I was in £40,000 of debt, and getting these red letters from through the door, which you'd never expect as a doctor who has high earning potential. Um, Things started to get a bit better. So I stopped the medicine. I did a lot of online CBT, but that did nothing for me. Really, I needed to go through my problems with someone and really get answers and understanding. I had a lot of psychotherapy up until 2020. I spent a month in Bali, and we all say Bali heals us. But honestly, the time to just focus on myself, climb mountains, be in nature, do yoga every day. I mean, how is that not going to be healing for you? And to be able to walk barefoot everywhere. So, a real healing journey for me. So we came into lockdown and things actually got a bit worse. My blood sugars were going up again. But then I realized that this wasn't just about the mind and the psychotherapy. And this is what I want to convey to you. All the different things that I'm talking about here is part of the healing journey. Not one thing specifically usually fixes things. And usually your combination that works for you is going to be the right way for this. So the next thing in my journey was to look at my physical health. So I started to focus down on my nutrition, and we know nutrition impacts mental health, and we know that exercise impacts mental health. For me personally, exercise itself, if it's a run, doesn't do anything for the way I feel. In fact, I feel worse after a run. But what does make me feel good is when I start lifting things or doing yoga, because I think it works really well for the mind. So I created a tracking system, a handwritten tracking system where I track a number of things for my nutrition, including stopping takeouts, reducing processed food. At the time, I just went plant-based completely, um, and the weight started to drop. I was cycling every day to work. I'd do a minimum 15 miles a day, 4 days a week minimum. The weight started to drop. Um, I was meditating twice a week. I was spending time with new people as I'd moved out of a single house into a house with other people who were also experiencing lockdown together. So conversely, I managed to get that really nice social relationships with 5 other people who all had their own interesting stories of what brought them to this house in Chelsea in London in the middle of lockdown. And combining all that all together, I actually ended up losing 12 kilos, which is around 20%, I think, of my body weight, which is a huge amount. But my blood sugars got better, my cholesterol improved, my good cholesterol went up, my bad cholesterol went down, my mental health was much, much better. I probably had too little body fat percentage, but my muscle percentage went straight up. My body fat percentage came down from around 17%, which isn't unhealthy. But for me, my blood glucose was quite high, and I got it down to under 10%. And that had to be increased a little bit after that. It's just to show that it wasn't just the mind stuff, it was the body stuff. So then a couple of years goes by, life seems to get back to normal again. But then after just actually 1 year goes by, and there were some other things that really helped me along that journey. So when we think about psychotherapy, we think about therapy as looking to the past, looking at what's going on, reevaluating things, re-understanding it. And often we think about psychotherapy as the things that are happening to us right now, today. But I just want to talk about coaching. Coaching is about looking to the future. And one of the things that people describe when they get depression or anxiety is this inability to think into the future. that they can't see the future, that they can't plan more than a week or two, especially when they're stressed and they're burnt out. How can you plan into the future if there's so much variability going on in your life and you don't feel that you've even got today right? How can you start to think about tomorrow? But coaching helps you to start to see perspective. And it helps me, especially at the time, it helped me, especially at the time, around the now and how to flip the now to what does my future want to look like? What might it look like? How can I make it not look like what it was now? What do I need to do in the future to not repeat what happened before? So I started on a coaching journey. I had a couple of coaches, had a mentor from the Royal College of GPs, all really helpful because I started to understand what is my values, what is my purpose, what do I want to achieve in my career and in my life moving forward. Because I closed the company that I put my heart and soul in. So what's going to be next? And so values and purpose is a really, really key thing here. But then the past started to rear its head. And there's only so much logic and intellect that you can apply to trying to fix something. And this is where in Western medicine and in Western society, we fall down a little bit. And you're starting to hear this undercurrent, and it feels a little bit woo-woo and a bit hoo-ha. But there is this undercurrent of alternative treatments that are coming through, that are seeping through. And even more so, doctors, surgeons, consultants are starting to seek this treatment for themselves. And I went a little bit on this journey, and we're not really allowed to talk about it, not able to talk about it at the forefront. But I went on this journey and I saw a therapist, and I saw a therapist who I could challenge what she was saying to me. Very experienced. She's been doing this for nearly 50 years, and she has done Western psychology based training. Then she went to the East and learnt all about the chakras and Ayurvedic type based treatments. And then she went into the Far East and was learning around feng shui, and then came back to the UK, or at some point in her journey learned about eye movement desensitization and reprocessing, and emotional freedom technique. And both of these, the eye movement one is around using eye movements to help tap into understanding traumatic periods and then trying to reframe them. And then emotional freedom technique is a way of releasing energy and also helping to release the energy that's pent up in our bodies from traumas. EFT and EMDR, emotional freedom technique, and eye movement desensitization and reprocessing therapy are now used in Western therapy, and psychiatrists are talking about it, psychotherapists are talking about it. It's now being accepted. The chakras are really interesting because when you look at the pyramid of chakras and you look at the pyramid of Maslow's hierarchy, they're very, very similar. The early chakras, the lower ones, they are foundational, and then the upper ones are tend to be sort of more aspirational, and also the development processes tend to be as we get older. Now, I can't tell you about the evidence base on this, but I can tell you that for me, going in understanding how those chakras um, affected me in terms of my development in childhood and dealing with some adverse childhood experiences, that was the way for me to repair some of those adverse childhood experiences. And when you repair them, suddenly things in your life now you start to apply to them and they start to become easier. So there's another modality that we need to be thinking about when it comes to really understanding about all the different things that are available to you to really try and get your mental health back in check. And then I went on a final coaching journey, and that coaching journey was with group coaching. That coaching allowed me to meet other people that were aligned in the right mindset as me to try and improve their values, their purpose, what they wanted to achieve in life. Some of them were going through a mental health journey, some of them were not, some of them were going through a transformational journey in their lives. So I just want to recap there. I've experienced poor mental health. That poor mental health developed over 2 years of real relentless stress in personal and professional life that led to burnout. There were perhaps some adverse childhood experiences that affect some of my behaviors and my interpretation and my response to stress, and that probably contributed to it as well. So the burnout itself wasn't just because of that current situation, it was about what had happened to me in my past and my behaviors and my actions and my responses to the things that were presented to me at that time. So 2 years of burnout, perhaps 2.5, coming into 2020, took 2 to 2.5 years to really get through. Of course, I needed to get my finances in check. I needed to pay off debt. I needed to finish the MBA, which I managed to do in 2023, the world's longest MBA, 7 years over here. Um, so that was all in check. But then also, I needed to go through and deal with the childhood stuff. I needed to look at the stress that had contributed to the burnout, the problems with the relationships. Then I needed to deal with the burnout, and that moves into my lifestyle. I needed to look at the nutrition, exercise, well-being, sleep, stress, all of that. I needed to get it in check. But it didn't happen overnight, and it didn't happen in a linear phase. These things are all happening together, and gradually over time, the body's responding. My metabolic health is getting better. My mental health is getting better. And then once you get to a point of equilibrium and say, okay, I'm okay again, where do you want to be? Where do you want to go? And that's where the coaching really becomes powerful. And you're also starting to question this yourself. You think about Maslow's hierarchy at the top. That's where we're starting to question and the art and the creation and the creativity of us. That's about reaching, and then think about the chakras. That's about reaching towards the higher purpose. How can you reach towards a higher purpose if you haven't got your foundational basics in check? So they're all interlinked. They're all talking a very similar message. So if I was to summarize, what are the things that were to bring this together from a lifestyle medicine perspective? I would look at some of the work from Martin Seligman, and I would look at lifestyle medicine, and I would combine them. Nutrition, exercise, well-being, sleep, stress, avoiding risky substances. That's your lifestyle medicine stuff. The one that straddles both Martin Seligman's positive psychology and lifestyle medicine is relationships, social connectedness, good, healthy relationships. When we think about positive psychology, there is the PERMA model. Positive relationships, positive emotions, engagement and flow states, relationships which are positive, meaning and purpose, and accomplishments. Now, the one that appears to be least impactful of them is the accomplishments, but the others are really, really key. And when you bring them together, you can use an acronym called PERMANESS, PERMANESS, positive emotions, engagement and flow states, relationships that are positive, meaning and purpose, accomplishments, news, which is nutrition, exercise, sleep, and stress. Get all that in check, and you have the recipe to be happy and healthy with resilience moving forward for longevity in your life. There is some contention around the blue zones at the moment, but I would say that the principles of the blue zones fit in very well with the positive psychology. And then when you apply that with the lifestyle aspects and that Martin Seligman's work around trying to look at NESS, nutrition, exercise, sleep, and stress, and combining with that, and we look at values and purpose, and we look at what it is to be a human, we can see that the Eastern medicine, the Western medicine, the South Asian medicine, all of it together is moving towards the same goal for us to be happy and healthy. One of the big differences between Western medicine and Eastern medicine is some of the Western medicine is looking at disease states, whereas some of the Eastern medicine is looking at well-being and wellness. So you can apply both. It may be that the Eastern modalities don't have the drugs or the surgical skills required to deal with some of the things that are developing later on in life or later on in disease states. But when you think about keeping yourself well, we can learn across the globe about lots of different things that help to keep our metabolic and mental health in a good place. Now, I've moved completely away from the starting topic, which was around men's health awareness. But if I can take my journey and hopefully you can learn something from that and take some insight from it and see that there are many ways to skin the cat, there are many ways to get well, and there are many ways to get unwell as well, then that's been my main reason to provide this talk today. So I hope you've enjoyed it. I look forward to catching up with you all soon.